Hi everyone. Thanks for joining us for video number 3. I'm Anne, and this is Judy, and we're coming to you from Active Health Solutions in Prince George. This is video number 3, and this is 3 weeks, 2 to 3 weeks to about 6 weeks post-surgery for breast cancer, partial mastectomy or full mastectomy. So it's similar to video 2. So when you're starting to feel a little better and that you're working your way through those exercises on video 2 and you want something a little bit more gung-ho, this is your video. So we're getting down to floor level. So you can see we've got a mat laid out. If you need to pad up your knees with a blanket or an extra yoga mat, anything like that, you can always fold it over. It's perfect. So we're still focusing on mobility, range of motion, and starting to return to a little bit more regular movement. So that's how you would pad those knees up for our first few exercises here. So you can pick and choose. We've got a number of exercises coming at you. You pick and choose what works for you. If you want to follow us along, this is a great mobility program for you. But work slowly, work gently, making sure that you're not bouncing, you're not flinging, that you're gradually increasing the intensity. Keep the range of motion small if you're feeling tight or you're feeling sore, especially on your affected side. And you can increase it gently as you're starting to feel a little bit better, you're starting to regain some of that mobility. So that's all you need for today is like a towel, a mat, a blanket, something that you can get down, a piece of carpet on the floor. So again, with your warm-up, do some walking, lots of arm circles, swinging your arms, that kind of stuff. Rolling out those shoulders. I would also increase things like stairs and hills. If you're out walking, start to change the intensity a little bit. And with that, we're going to just get right into it. So first of all, Judy's going to come into a tabletop position here. And I call this a tabletop position, but she's on it's a 4-point position. So she's going to start with her wrists. So we're just going to go back and forth, working on those wrists. Just trying to increase range of motion here. You can go back and forth, side to side as well with those wrists. And even some half circles. So anything that's going to get them going in different directions. I find a lot of the adults that I work with, I don't know if we've had wrist injuries or we're just getting arthritic or what it is, but our wrist mobility starts to really lack. So, and you can do some half circles as well. No, just with the wrists in back and forth. We'll get to the shoulder stuff, I promise. And the next one, after we get into our wrist circles here, is our cat and cow. So hopefully you've done some of these things in yoga class before. So she's really pulling up to the ceiling and then arching all the way through. Your back turns into like a hammock, arch back up to the ceiling, come all the way through. You can raise your head as well. There we go, so that we're kind of working through some spinal flexion and extension and our neck mobility as well. So that's our cat-cow. So again, we're aiming to do these about 5 times before we switch to the next one. So that's cat-cow there. And then we do what I call a crazy cat. So that's coming around, and I always joke to say, when I teach this in class, you're looking around to see if you have a tail. So try and just look all the way around. It's kind of the lateral mobility is what we're kind of working on. So that's crazy cat. Never seen an animal chasing their tails. That's what it looks like. And that's number 5. There's 5. So that's crazy cat. And then we can move into some hip circles. So from this tabletop position, we're going to just do half circles around the back. Yeah, big circles like you're drawing a big circle with your behind, with your pelvis. And again, you're going to go in both directions. So hopefully you got a couple of those in you. So now we're working on hip mobility side to side. Looks good. And then we're going to go into some shoulder blade push-ups. So all we're moving here now, arms are extended, and we're pinching our shoulder blades to our spine, and then pressing them off and kind of rounding them. So it's just our shoulder blades that are moving on our shoulder blade push-ups. Is that 5? I've lost count again. One more. Good thing she's counting. Okay, and then the top half is going to stay exactly where it is, and we're going to see if she can do pelvic tilt. So now she's doing essentially just movement through her pelvis. So it's going to rotate anterior, posterior, boom, rotate this way, just with the pelvis. And again, I know that this isn't necessarily helping you recover from your surgery, but we do find people get very tangled up through their lower backs because of just how much rest you need. Okay, so that's our pelvic tilt. And then she can sink back into a child's pose. So hopefully you've done this in yoga, and now this is starting with some lat stretch. Now she can bring one hand down back beside her, or even pull it back ever so slightly if your lats or if your pec muscles really aren't happy when you do this. So you can kind of wiggle around till you find that when you're not just getting super stretched with this. Okay, so she's got pretty good mobility even on her affected side, so she's able to do the child's pose a few times. So this is a resting pose, but it's really good for your range of motion in your lat muscles. So that's child's pose, and then we're back up into our tabletop position, and now she's going to do a thread the needle. So we would do 5 on the right and 5 on the left. And now we're getting into some rotation, spinal rotation. And again, you're still opening up that chest with a big upward sweep here. Looks good. Okay, now she's switching sides. So there's our 5 on the one side, 5 on the other. So hopefully you're feeling okay in this tabletop position. Again, take breaks when you need it. Press the pause button. Come back if you want. Then from here, we're going to do a leg extension. And so she's shooting it straight back, one leg straight back, and she's just going to lift up and down 5 times on the right side here. Now, this one is just for those long back muscles, right? Those need to be strengthened so that they can hold our pelvis in the right spot so that we don't slump it under, so we don't slouch, because that's kind of a big issue for us when we're not as active as we're used to being. Okay, so those are 5 leg extensions. And then a mini push-up. So it can be any format you like. So here's from a tabletop position. Right, we did these last video on the wall. So this is from a tabletop position. As you're feeling a little stronger, you can go flatter. If you're not feeling it, you we'll pull it in like she's doing in this example. So these are our small little push-ups. Again, now we're starting to just tweak a little bit of strength, which is what we're looking for. The next one is, and she's going to give you a great example of a good push-up there from your knees. And then back to child's pose, that's stretching it out again, because now you've done a little bit more work with that pec. The next one we're doing here is a downward dog and then an upward dog, and we can just do this once or twice, not a lot here, and then we're going to flip over onto our backs. So the downward dog, there we go, getting into a nice letter V, upside down V. So she's pushing up. Again, this is really going to be challenging in those shoulders. So please go carefully when you're doing these ones. Okay, maybe we'll cut it off there. I think, is that 4? Okay, and then you can go into an up dog. So now you're going to sink your bottom down like a hammock and coming forward. And now we're just trying to go in reverse. These are really challenging. Our poor backs. They don't move like this. They don't like it anymore. That's plenty. So that's just opening you back up in the other direction. All right. Next move is we're going to flip over onto our backs. We can untangle that mat if you want. There we go. I can help you with that. Okay, so we got a few exercises on your back. The first one is just a straight overhead stretch. And again, depending on your affected side, how mobile you are to do this overhead, this flexion position, could be a little challenging. This is really good for range of motion. Hopefully we haven't tired you out too much in that tabletop position. And then after you've done your 5, you're going to switch it to a butterfly stretch. So then it's into this position and it's just opening it up, squeeze, and then back open. So 5 of those butterfly stretches. Head's on the ground. Yes, sorry, I should have caught that. And the advanced one from this one, from the butterfly stretch, the next one that we build on is, we call them floor angels. So imagine you're a little kid again and you do snow angels. But we like to keep our forearms and our hands on the floor. So if you're finding where they pop off, you know, if it's at shoulder height or above, we want you to just stay below that height and keep your arms on the ground, and it's really going to open up your chest. And gravity is going to help you on this one, get you open versus, say, on the wall or just even standing. These are really easy to cheat. So this is a really nice, gentle stretch. These are floor angels. And once you're done that, we'll move into a spinal twist. So knees will drop down to one side. So now you've got those arms. We're trying to keep our shoulders on the floor, but they probably will pop off a little. And we're just going to go back and forth a few times for a spinal twist. Trying to open you back up. Get that spine moving. Get that spine rotating a little bit. That's 3.
And this might bother the affected side.
Yes, so she just reminded me that depending on how you've had your surgery, right, your affected side, it might pop up a little bit more. We want to make sure we're doing this safely, but you may have some imbalances because of your surgery. So just keep that in mind and then work carefully on that one side. Then we go to a dead bug. So a dead bug is opposite. So you start in this reverse tabletop, and the leg that goes straight, it's the opposite one that goes back. So you're kind of working in opposites. And so this one might take you a minute to get the first one, get the rhythm going on the first one. And this one is for core. So we want to make sure that your core is nice and strong, because that's going to hold your posture. And you're going to do 5 little dead bugs. Okay. Well, yeah, that's what it's going to look like. So you start from that position, and then one hand's going to drop and one leg's going to drop. And then we're moving into a bridge. So with your, and you just sort of peel off your butt, your behind off the ground, and up you go. And we want to try and get in, it's almost like an upside down plank where you're nice and straight. And as you come up, you're going to squeeze your bum cheeks together, right? That's going to be good for those glutes. But again, it's good for your core, right? Your abdominal muscles, that's what we want. 5 little bridges there. I think we've got one more, and then we're going to show you a hamstring stretch, just because we've done some work here now, and we're just going to do some range of motion. So this is a hamstring stretch. Some people will do this with a yoga strap or a towel, something like that. So this is range of motion in the muscle that's on the back of your leg. The big muscle. So that's a nice stretch, a nice hamstring stretch for you, and you'll switch sides. You don't have to do this one 5 times. You can just keep it up there and hold it for 15 seconds, 10 seconds, till you kind of feel like it's unknotted itself again. All right, and after she's done that, she's going to sit up and do a side stretch, and then we're going to stand. So we got one last one here, and we're going to go up and over and just side stretch both sides. Couple more, one more maybe each side. That's a good one. I'm going to move the camera as she stands up, and we're going to get to just a few exercises standing up. Okay, so the first thing that we're going to do is external rotation. So hands out, arms out, 90 degrees here, and we're just opening up our chest again. So this is external rotation. That looks good. 4, 3, 5. Okay, and then she's going back to her pec stretch on the wall. We showed you this one last class. And you're stepping a little bit forward, right? So just opening back up. So she's creating a 90 degrees. She does this one in her door jam at home. So doing a little bit of a stretch here. And switching sides. Let me get this out of the way. There we go. Okay, and then do you want to try our Swan Arms? We were just going over these ones. Okay, Swan Arms. So this is a little mobility series we like. So you're going to start palms up. You're gonna pull it in, come around, dive into the pool, round your back, then up you go. Open up to cactus arms and sweep them all the way through, go again. Pull it in, dive in the pool, around, up we go, open it up. Let's do that a couple more times. Here we go, dive in, open it up. Should we do it one more time?
Yeah, maybe I'll get it right.
Okay, so that's our Swan Arms. Okay, then the next one that we like to do a lot of here at the studio are called Ytws. And so we're gonna bend forward from the hip. So we want a nice flat back here. So we're gonna go a Y, letter Y, then a letter T, thumbs up, and then a W. So you want to imagine from behind you're creating a W. Y, T, squeeze, W. Y, T, W, squeeze. I think this is 4. Last one, shoot it up, Y, T, W, well done. Last few, we're gonna do a few hip lists. So back on the wall there, if you wanna lift those hips up. So she's just grounding with the one foot and pulling up with the pelvis on the other one. Again, trying to untangle some of this, some of your lower body muscles that haven't really been too challenged because you've been resting what you've needed to do. So hip lifting, so she's just working on that pelvis up and down, so 5 on either side. That looks great. And then we're gonna do our pelvic tilts is next. So we kind of come a little bit forward and then we're gonna crunch pelvis under and then shoot it back, pelvis back. So forward and back, that's 2. Under, back, 3, 4, and yeah, these ones are really tricky. Our lower backs don't like this one. Okay, and then from there, we're just gonna do some rotations, a few little rotations here, and then we'll move into the 3-point touch. So you're going onto the wall, and we're gonna go touch forward, side, back, shoot it through. Forward, side, back, shoot it through. So this is all just in your hip, again, for this hip mobility.
Yeah, you could do this standing in the kitchen, right?
You absolutely could. Any of these, as you're waiting for your kettle to boil. These are fantastic. Okay, and then a few little air squats, and this is going to be a last little bit of strength. She's got a beautiful squat posture. She's going to do 5 of these, and then we're going to shake it out, and that'll be another video in the books for us. Okay, so then you've kind of started to do a bit of strength stuff. Loosen it up, shake it all out. You can do some circles and some shoulder relaxers, I guess you could say. And thank you for joining us, and we'll catch you for video 4, which will be 6 weeks post-surgery, and we'll be building on some strength. Thanks, everyone.